Did you know that according to Dr. Charles Heineken's June 2016 article, The Overview of Primary Prevention of Coronary Heart Disease and Stroke, that cardiovascular disease is the leading cause of death worldwide? A disease that has modifiable risk factors is killing our family and friends. Heineken's article states the following as risk factors that can be modified to help prevent heart disease: smoking avoidance or cessation, overweight and obesity, diet, physical inactivity, dyslipidemia, hypertension, and diabetes. Heart disease has become the leading cause of death in the United States. There's modifiable risk factors that, if educated, the general public can begin to make lifestyle changes. Heart disease can be prevented through avoiding smoking and smoking cessation. You might be saying, easily said than done. But according to Heineken's article, the benefits of quitting smoking start only a few months after stopping. And within a few years, you can have the benefits that non-smokers have and be healthy. One factor that stuck with me is that for heart disease, it's never too late to stop. But with cancer, it's never too early. You're probably also wondering, how do I quit? Heineken's findings are that smokers need to be counseled regularly in conjunction with nicotine replacement and other medications in order to be successful. So if you're a smoker, remember, it's never too late to quit to prevent heart disease. Heart disease can be prevented through controlling hypertension or high blood pressure. According to the American Heart Association's website, hypertension can be defined as a systolic blood pressure greater or equal to 140, that's the top number of your blood pressure, or a diastolic blood pressure of greater or equal to 90, that's the lower number on your blood pressure. Treatment for hypertension and early diagnosis can help prevent heart disease. The treatment for hypertension, as supported by Heineken's June 2016 article, lists that there are both pharmacological and non-pharmacological measures to lower your risk of heart disease. Heineken in his June 2016 article lists non-pharmacological measures include weight loss, salt restriction, and avoiding excessive intake to help control your hypertension, thus lowering your heart disease risk. So early diagnosis of hypertension and treatment of hypertension can prevent heart disease. Heart disease can be prevented through maintaining a healthy weight or losing weight if you're overweight. This can be achieved through maintaining a healthy diet and increasing your physical activity. Heineken's June 2016 article suggests and supports that people with a healthy weight have a lower incidence of diabetes and hypertension, thus lowering your risk of heart disease. The American Heart Association has a website that has a useful tool for guiding your exercise habits. This tool states that at least 30 minutes for 5 days a week of moderate exercise for a total of 150 minutes, or 25 minutes of vigorous aerobic exercise 3 days a week to equal 75 minutes, as well as 2 days a week of moderate to high intensity muscle strengthening is necessary to prevent heart disease. The American Heart Association tool also shows if you've been diagnosed with high blood pressure or high cholesterol, you need an average of 40 minutes of moderate to vigorous activity 3 to 4 days a week to help prevent heart disease. So a healthy weight and healthy diet, as well as physical activity, can help prevent heart disease. Heart disease can be prevented through the treatment and early diagnosis of dyslipidemia, or high cholesterol. The American Heart Association's 2013 Guideline on Lifestyle Management to Reduce Cardiovascular Risk recommends a diet with an emphasis on the intake of vegetables, fruits, and whole grains to help lower cholesterol. The treatment of dyslipidemia also can be achieved through the use of statin medications recommended by your physician. I find it interesting that a healthy diet can help lower your cholesterol, as well as this next topic we're going to talk about. Heart disease can be prevented through controlling blood sugar if you're diabetic, or preventing diabetes from developing in the first place. Heineken's June 2016 article states that there's an epidemic and pandemic of type 2 diabetes resulting in overweight and obesity. The American Diabetes Association Diabetes Care from January 2016 cited heart disease and other vascular complications as the leading cause of death among diabetics. Preventing yourself from forming diabetes in the first place should be goal, and this can be achieved through a healthy diet, active lifestyle, and maintaining a healthy weight. Heart disease can be prevented through the following guidelines set forth by the American Heart Association in conjunction with those I reviewed from Heineken's June 2016 article. The modifiable risk factors we've reviewed to prevent heart disease are smoking avoidance or cessation, maintaining a healthy weight, following a healthy diet, blood sugar control to prevent diabetes, treatment of dyslipidemia, and the treatment and management of hypertension. I urge you to start adapting your lifestyle. Make a change today. Stop smoking. Start living a more active lifestyle and make better food choices. You have the power to change your future of health and prevent heart disease.